Hi guys, so our next video is going to be on the system controller and how to manipulate it, okay? So on your system controller, there are 3 buttons. You have your battery button, your alarm silence button, and your display button. Everything else that's not a button, all these little things, these are lights, and this is what's going to illuminate when an alarm goes off. And when they illuminate, each one has a different meaning, which we'll discuss in a separate video, okay? The most important one that I'm going to touch here, that's not a button but is a light, is this symbol right here. This is your pump running symbol. 24/7, 365, this has to be illuminated green. If you ever notice that your pump running symbol is off and it is black, that technically means that your pump isn't running. So if you ever notice that this is black, you should lay your patient down. You should auscultate their chest and listen for an VAD hum. If you do not hear that mechanical hum, their pump is off. That's an emergency. All right, so just remember, pump running symbol always has to be green. Now talking about the buttons, you have your battery button. It realistically has 3 functions. So the first one is you're gonna hit it and let go. That shows you how much battery life you're on. Right now I'm on wall power, so it should always be 100%. The second one is if you hit it and hold it for 5 seconds, that is your daily self-test. That's gonna be a separate video. Just know that 3 things happen. It is all the lights illuminate, your screen says self-test, and you're gonna hear a very loud alarm for 15 seconds, all right? The third thing only happens if you're doing a controller change out and your current controller is not connected to anything. There's no drive line and there's no power source. If that's the case and it's alarming, if you hit and hold the battery button for 5 seconds, it will actually shut your controller off. Remember, that is only in the case that this is not connected to your patient, the drive line is disconnected, and there's no power source. That is when this would shut it off, okay? Your next button is your alarm silence. There are 2 types of alarms. Remember, advisory, kind of like your check engine light, you have time to fix it without hurting your patient. That could be silenced for 4 hours. And your hazard, that's kind of serious. They can only be silenced for 2 minutes because it's immediately going to impact your patient's health. So these can silence all alarms, hazards 2 minutes, advisories 4 hours. Your last button is your display button. This is if you don't have a system monitor for some reason and you need to discuss the patient's numbers, you can get them all here. It would be speed, flow, PI, and power. And then it's just letting you know that the backup battery is charged, okay? Last one, fun little function, if you're at a test and your patient happens to alarm, but when you get to the bag, the alarm resolved, you're actually gonna hit your alarm silence and your display button at the same time. A brown screen is going to pop up. It will say date, time, name of the alarm, and how long it was ringing, so you know what's going on with your patient. And that is system controller functions.